So the City Council is pushing back on the mayor's budget, which trims funding for mental health services.
That's right. The council looking to restore funds to help the city deal with the current mental health crisis. So Queens Councilwoman Linda Lee is the chair of the Committee on Mental Health, Disabilities, and Addiction, and she joins us this morning to fill us in on where the budget cuts stand. Councilwoman, great to have you here.
Thank you so much for having me.
So let's talk about this. Mayor Adams has allocated $757 million out of his $111 billion budget towards the Department of Mental Health and Hygiene. But that's a cut, right? It's less than what you've received in the past. So how do you see that all playing out in terms of how it would affect some change?
Sure. So let me just first start by saying that $757 million, when you're talking about a $111 billion budget, is just pennies in the budget. And we're talking about a time where we should be investing more in our services on the ground, emergency response teams. And what we have requested in the preliminary budget was a little over $200 million. That didn't get any sort of response, and so in the executive budget, which is now the final negotiations, we're requesting $43 million, which is, again, not that much if you're talking about a $111 billion budget.
In addition to the 757.
Right, in addition to restore, yes, some of the programs. And so the $43 million that we're asking for is for supportive housing, social work fellows, programs and services that are really going to help what we're seeing on the ground right now. And so far we have gotten $0, but you know, we're still in the final stages of negotiation. So we have until June 30th. Yep. Hopefully by then we will see more, you know, inputs into the budget before then.
How much is being invested in these crisis teams? Because just this week, Councilwoman Shahana Hanif said the NYPD should not be involved in responding to these crises, like the one that led to the death of Win Rosario back in March. How much more do you think needs to be invested in these crisis teams? And do you agree with her, first of all?
So, first, I just want to say to Win Rosario's family, it's a tragedy, and unfortunately, it's a situation that was sort of a perfect storm of decades of disinvestment from the mental health system. So we've been deinstitutionalizing and giving less and less funding into our mental health care system for decades at this point. And on top of that, we're expecting NYPD to be the catch-all solution for everything. So they're responding to a lot more crises. To be honest, they're not mental health professionals, right? And we do have a lot of response teams, right? The tricky part, without getting into the weeds, is that a lot of these street response teams and folks that are supposed to go to people's homes to respond to severe mental illnesses, some are run by state agencies, some are run by city agencies. They all have slightly different portfolios. Some of them depend on what insurance you have. So it becomes this very complicated, broken system. And so what we know for sure, though, is that when you invest in housing, when you invest in outpatient clinics, when you invest in the nonprofits that are doing this work on the ground, you see a lot less people going into the emergency rooms and also ending up in the criminal justice system. And if we invest and prevent these situations from happening in the first place, then we will see less and less of these incidents happening.
The root, get to the root of it.
Exactly.
And there's the prevention aspect of it, right? But then there's also the back end, which is a lot. We hear a lot about mental health and taking people out of the subway, right? Putting them somewhere. Where? And then what happens after that? Because a lot of folks who go into treatment or go into a facility are right back on the street without the services. So how do you see the budget playing out to help with the treatment and not just a release?
Right. So I think two things. So this is actually some of what our mental health roadmap addresses at the city council level. Is it involves not just the resources, but also how do you ensure that there's going to be a smooth handoff and a smooth transition, right? If I'm coming out of outpatient, how is the system going to make sure that I seek services and continue my treatment thereafter, right? And then, you know, so at every step in the point, there has to be catch areas so that people don't fall through the cracks. So that's the tricky part, is that we have to make sure that all the city agencies are communicating with each other, communicating with the hospital systems, the nonprofits that are providing these services, but also, you know, when you look at the crisis response teams and the outreach teams, for example, in the subway, from a funding aspect, you know, we've seen reports that in terms of NYPD overtime, that's about $2.5 million per week that is going into overtime. So my question is, what would that look like if you were to take that $2.5 million a week and reinvest it into the community and into the systems that are meant to prevent these folks from getting into that situation in the first place?
Yeah. Before we let you go, we also want to ask you about maternal health, because that's also a huge concern for underserved communities. How is the council addressing that?
So what we know for sure is that, with maternal health in general, birth rates really are, the birth rates and what's happening in the community really impacts Black and brown and immigrant communities, minority communities, far more than white counterparts. And so what we're trying to do with the maternal mental health, because we've actually also seen reports that a lot of mothers are experiencing more suicidal thoughts as well as overdose because they're not sure where to go for services, how to handle a lot of the impacts that they feel once they do give birth, and also if there's a loss of a child or if there are any complications. And so this is an issue that, quite honestly, a lot of our communities have stigma about still, even in this day and age, right?
Yes.
So where do you go to talk about this to say that you even need health? So the next stop of our roadmap is planning on talking about maternal mental health specifically, how we can help bring that voice and raise that, break down the stigma in a lot of our communities out there that we're seeing that typically don't talk about this issue.
All right, Councilwoman Lee, keep us posted. I don't know, I'm sure the negotiations continue to end on that final handshake on June 30th, so hopefully you get the funding you're looking for.
Yes.
Keep us posted, okay?
Thank you so much.
Thank you.
Thanks for your time.